Hi, my name is Brendan. Hi, my name is Brendan, and today I'm going to be talking about the epidemic of LGBTQ youth homelessness and the community response to it in Philadelphia. This bin talk comes from my senior capstone that I completed for the Civic Scholars program at Penn, which is a program that recruits cohorts of students based on their interest in social justice and civic engagement. I wrote my senior capstone on the network of resources, or in industry jargon, the continuum of care for LGBTQ youth experiencing homelessness in Philadelphia. This is an important issue because not only do youth represent the fastest growing segment of the homeless population in the US, LGBTQ youth constitute about 40% of that population. This gross overrepresentation is exacerbated by the fact that across the country, service providers are ill-equipped to address the specific needs of the LGBTQ youth population. Not only are the specific services LGBTQ youth lacking in quality and capacity, prejudice and or lack of education on the part of service providers results in discrimination from the organizations seeking to serve these youth. This renders LGBTQ youth significantly less likely to access the resources they need to stabilize. With this in mind, I designed a project to document and assess the quality and the capacity of the services available to LGBTQ youth experiencing homelessness, as well as the current state of coordination in the continuum of care in Philadelphia. In order to do so, I conducted extensive literary research to identify universally agreed upon best policies and practices by researchers, advocates, and governments. From there, I conducted 22 interviews with administrators and service workers at the 8 most prominent homeless youth serving organizations in Philadelphia, as well as a series of interviews with government officials and academics. I was also able to sit in on meetings, observe service provision, and explore the spaces in which LGBTQ youth are being served. My findings are as follows. In terms of service, the strengths of the Philadelphia continuum of care are as follows. System-wide, organizations had adapted 80% of the best policies for LGBTQ inclusivity. This is thanks largely to the advocacy of the Attic, which is an LGBTQ youth serving organization that has done effective advocacy to spread LGBTQ education across service providers around the city. 100% of the agencies mandate at least one LGBTQ cultural literacy workshop for new employees, and half of them have one regularly. Finally, 100% of the housing agencies offered LGBTQ affirming healthcare, education and employment support, and counseling directly or by referral, which is extremely important as just giving a youth a house or a shelter is not going to end homelessness. It's simply prolonging it. You have to we have to provide holistic care in order to help youth gain independence. On the other hand, the shortcomings are that LGBTQ specific housing is in short supply. This is particularly dangerous as shelters and other forms of emergency housing tend to be extremely dangerous for LGBTQ youth. They are subjected to elevated rates of physical and sexual violence in those community spaces, and thus need LGBTQ inclusive housing options. There's a significant unmet need for LGBTQ and youth competent counseling options. So there are several organizations that are LGBTQ competent, and there are several organizations that are youth competent, but there's only one organization that has both LGBTQ and youth competencies. Finally, there's a severe lack of community space and community programming for LGBTQ youth. These are particularly important as LGBTQ youth are generally isolated from their families and the communities in which they grew up. And it is extremely important for their mental and emotional well-being that they feel a sense of belonging. In the realm of coordination, the establishment of a coalition for ending youth homelessness in Philly, called the Philly Homes for Youth Coalition, has allowed the continuum to make great progress in the last couple of years. A coordinated entry access program, which acts as an inventory and resource matching system for youth based on their needs, was implemented in March 2018. This system makes it significantly easier for case managers to help youth access the resources they need to stabilize and work towards independence. A system-wide information management system for youth called the HMIS was implemented in June 2018. This is particularly useful in that it allows the coalition to track which youth have fallen out of service provision and try to help them re-enter the continuum and work towards independence. Finally, the establishment of this coalition has facilitated coordination and fostered new relationships among providers. On the other hand, while the founding of the coalition has laid the groundwork for coordination, there's still a lot of work to be done to have a truly integrated network of care for LGBTQ youth. Uncoordinated intake procedures make the process repetitive and arduous in that every time a youth wants to access a service from an organization they haven't been to before, they have to go through a pretty standard intake procedure that every other organization that they've accessed services at has. Second, youth-specific street outreach efforts are not coordinated, which represents an enormous waste of human capital. And finally, age eligibility requirements vary enormously among youth-serving organizations, which complicates the accessing of services for youth. So the significance of my findings are that they provide a comprehensive account of how the community is serving LGBTQ youth experiencing homelessness, which gives the Office of Homeless Services, the Coalition, Philly Homes for Youth, and individual service providers an idea about what they should be prioritizing and the direction in which they should be heading. After I finished this project, I sent a memo to every organization that I studied with policy and practice recommendations, as well as with recommendations for other organizations with whom they should connect in order to sort of forge more efficient paths along the continuum. I have applied to the President's Engagement Prize with the hopes of starting a host homes program and a family reunification service for LGBTQ youth, which were the two most prominent or important recommendations I made for the improvement of the service provision in the Philadelphia continuum of care. So hopefully the significance of this project is that I'm able to help make any sort of impact on the short-term and long-term outcomes of LGBTQ youth who are experiencing homelessness in Philadelphia. That's it. Thanks for tuning in. I'm Brendan, and this was my Ben Talk.